Hey everyone, I'm Abby and I'm here with nursing.com to talk to you about a lab value for hepatitis B. It's the surface antibody test. Let's get started. The surface antibody test for hepatitis B virus measures the amount of antibodies present in the system, not the amount of virus. This is an antibody test. Now, this is used in evaluation to see how effective the vaccine was. It's typically given in a series. It also helps to monitor whether those antibodies have created immunity from an active infection. Now, speaking of vaccines, did you get loaded up before nursing school? I sure did. Now, when would you think this would be indicated? What populations tend to suffer with a lot of hepatitis B? It's passed through bodily fluids. Let's take a look. As mentioned, it's screened for evaluation of vaccination. We would also take this test if there was a known exposure. It's also very routine in pregnant women and especially important in those that might be immunocompromised because they can't mount an immune response. Therefore, the hepatitis could actually take over and take hold. Now, there could even be a transmission through IV drug use, since it is passed through bodily fluids. Now, some patients we would be particularly concerned with would be patients that are HIV positive, Hep C positive, and those, again, that might be taking medications or have other conditions that are dampening their immune system. Lab results are either negative or positive. If it's negative, you are considered unprotected. There are not enough antibodies to protect you should you have exposure to the virus. If it's positive, you're protected. This is taken by a titer. You may have had titers taken after receiving a series of vaccinations. This lab is collected in a serum separator tube or a gold top. Our linchpins for this lesson are that this tests for the surface antibodies, so the number of antibodies against the virus, not the Hep B virus itself. If your result is negative, you're unprotected. Your body won't have those antibodies to be able to fight off the virus effectively, as if you were protected or vaccinated or had already previously been exposed. Vaccination is incredibly important. It's especially important for those that are high risk. So those would be patients that are immunocompromised. Let's not forget our HIV positive patients, those that already are suffering with hepatitis C. This could even be those that maybe have risky sexual practice or are IV drug users. They need to be vaccinated and need to be monitored to ensure that infection doesn't take hold. You did great on this lesson, everybody. You can do this. Now, it wraps up our lesson on hepatitis B, surface antibody test. Now go out and be your best self today. And as always, happy nursing.